Hi, I'm pleased to present our recent research work at this conference. The work I'm going to present has the title Decentralized Identity Management for e-health Applications, State of Art and Guidance for Future Work. And I who present this work, my name is Anton Hasselgren. I'm a researcher and a PhD candidate at the Norwegian University of Science and Technology in Norway. I do research around the blockchain applications in the healthcare sector. In particular, I'm looking into ways for competence verifications and different systems for incentivize participants to increase participation in health and medicine research. My colleague, who I have been doing this work with, is Abelay Satabaldi. He is a colleague at the same university in Norway. He is doing his PhD in decentralized identity management and different solutions for privacy-preserving techniques. We are both involved in a number of committees and organizations in our respective fields. So the objective of this research that we have done was to summarize the state of art for decentralized identity management in the healthcare sector. Based on this summary, we provide a viewpoint how you could utilize and should utilize decentralized identity frameworks for different e-health applications. We did this by doing a scoping review of both peer-reviewed academic literature and also gray literature to capture what is currently being developed in the private sector as well as in the academic sector. I guess everybody who attends this conference are quite familiar with blockchain technology and different distributed ledger technologies. So I would just briefly describe this technology by one slide. So many people are considering blockchain to be a disruptive technology, me included, and that the technology will disrupt different parts of the society, including healthcare. In the current pandemic, we saw a rapidly increase usage of different virtualized healthcare services, telemedicine services, for example, where you could meet a physician by video or by phone or by chat. And all of these new sort of, maybe not new, but e-health services that is more and more used, they require some kind of digital identity management. We will come back to that. Blockchain technology and different method for decentralized identity management could provide a really good solution for handling identities and for enable patients to be able to identify themselves and for healthcare workers to be able to identify themselves without the need for any central authority or third party that are controlling your verification documents or credentials. So in this figure, we mapped out some of the activities that are going on in the health sector. This is not including, of course, everything in the health sector. Is very complex and big area and a large sector. But this is some example, and we can take a look at the lower part of this figure. So we see that the patient or the citizens, I guess all citizens are patient at one point in their life, at least in most part of the world. And for these activities that the patients are involved in, they all require some kind of identity proof. So the patient needs to be able to prove that they are, well, in fact, a real person if this is done virtually, and that they say that they are who they say they are. That's an important aspect, and also some of the activities that is performed by clinicians or healthcare workers, as you can see in the middle here. So basically delivering healthcare, and if we are delivering healthcare in a virtual setting, we still need to be able to prove that the doctor is actually a licensed doctor, and that they also are who they say they are. And preferably, we want to have maybe a system that could verify the competence and experience from the different healthcare workers. So we could find a physician or a nurse that has the right competence and experience to deal with our particular health problem. This figure is also quite a basic figure, and it represents basics of decentralized identity management. And this is also the basic for what is soon to be a standard called verifiable credentials, developed by W3C, together with the decentralized identifiers, also known as DIDs, which is also soon to be an open standard developed by the same organization. So what is going on here is that the issuer, could be the government, for example, issue credentials to the individual who store the credential in their digital wallet. And when they need to present their credentials, if they need to present proof of their identity, for example, they present it to the verifier. The verifier then verifies that the credentials that has been presented to them is authentic by going to the blockchain or to the distributed ledger where these decentralized identifiers are stored to verify that the authenticity of this. So they don't need to go back to the issuer. And this is the core component. So you don't need any third party to validate the credentials. So in our scoping review, we looked at the literature. We didn't include, we just include a sample, and this sample were made, it's not a randomized sample, so we just took this sample based on some solutions and concepts that uses different technologies. We included 3 from the private sector and 3 from the academic sector. What we can notice here is that these 3 from the academic sector all use the Ethereum protocol and Ethereum blockchain. The health ID, they use the Ethereum protocol, but not the Ethereum mainnet, but they created an own consortium that they run the protocols on. Because the one problem with using the Ethereum blockchain and implementing solutions on the Ethereum mainnet is the the scalability. So you usually have quite a large gas cost, so a large monetary cost for transactions and for the use of smart contracts on the Ethereum mainnet. So for these solutions, there is a lower scalability. But still, in the academic literature, you see that Ethereum is the most widely used blockchain and protocol for different e-health applications. This is probably due to the large community of developers on Ethereum, and also the large resources, open source resources that can be found in the Ethereum community. So it's very easy to, well, it's easier to develop a proof of concept and to experiment with this blockchain than perhaps other blockchains. None of these concepts store any identifiable information on the blockchain, which is, I think, is an important feature for to have a feasible concept, because if you store any identifiable data on the blockchain, you get it's very difficult to comply with GDPR and HIPAA if you're dealing with healthcare applications in the US. All of the solutions present open source code. And the three concepts developed in the private sector, they all use the DIDs, the decentralized identifiers. Storage is a mix between cloud storage and local storage. We did a small evaluation of these concepts by applying 7 criteria that was originally developed by Boras and colleagues not that long ago. They presented it in the paper. And I think these 7 criteria fits very well to the needs in the healthcare of identity, decentralized identity management. So you have autonomy and portability, authority, availability, approval, confidentiality, tenacity, and interoperability. And ideally, you should, I mean, these are not sort of binary criteria, but they could rather be on a scale. And ideally, you should your solutions should score quite high on each criteria to be a valid concept to be able to use in the real world in the healthcare sector. So we scored these different solutions that we showed previously according to these criteria. And as you can see in this table, they all scored quite similar. So we have a high score on approval. So they all enabled the individual to approve the use of their credential in a very good manner. Availability was also scored quite high. So the data is made available. But on the other hand, interoperability and autonomy and also authority, they scored, most of them scored a little bit lower. For interoperability, for example, I think there's always an issue when you're applying blockchain technologies that your solution is sort of tied to a particular blockchain and sort of lack interoperability between blockchains, for example. Autonomy also scored a little bit lower since most of the solutions were sort of dependent on the on the particular solution. But the total score was quite even on the six different solutions. So what conclusions could be made from this? So as we mentioned previously, as we most of us are well aware that the healthcare is being more and more digitalized, and more health services are delivered virtually. So there is an increased importance to be able to verify the identity of different stakeholders within this virtualized healthcare environment. And if you develop a decentralized application that has many advantages compared to a centralized, you should consider and also applying a decentralized identity management system, because if you apply a centralized identity management system on a decentralized solution, you sort of miss a lot of benefits with the decentralized part. Many of the recent developments that we have showed a few in this presentation, they come from the recent development of open standards like the DIDs and the verifiable credentials developed by the community of W3C. And we will soon see real standards coming out of this, I believe. To be able to see more of our work and some more results and conclusions, we will present this in our upcoming paper. So I recommend you to read this paper. With that, I thank you very much for your attention and have a nice continued conference. Bye.